Hello everyone. In this video I'd like to share some research on diet interventions to help improve some deficits in different areas of functioning in neurodiverse children. There is a lot to get through, so let's get started. So here we have the first study, gastrointestinal symptoms in autism spectrum disorder. That's a meta-analysis. That means that they have analyze different studies to make this one. So as always, the links are here as well as in the description, so you can have a look at the details. So basically what it comes to say is that children with ASD experience significantly more gastrointestinal symptoms than neurotypical children. So for example, higher rates of diarrhea, constipation, and abdominal pain. So it concludes that there is definitely something different about the GI tract in children with autism. Maybe some difference in microbiome and things like that. We'll talk about microbiome a bit more in another study. So let's move on. Here is, it talks about the ketogenic diet versus gluten-free and casein-free diet. In case you don't know what the ketogenic diet is a diet that is high fat, moderate in protein, and low carb diet. It only allows whole foods, so no processed foods. It avoids grains and high carb dairy, like things like milk and milkshakes and things like that, but they still eat cheese and full fat yogurt. The study mentions two assessments, so I just explained briefly what they are. The ATEC measures changes in ASD symptoms, is a broad range of them, so they have subscales, speech language communication, sociability, sensory cognitive awareness, and health, physical and behavioral issues. Then we have the CARS. The CARS is a diagnostic tool. ATEC is not a diagnostic tool, it's just to track progress. So CARS is a diagnostic tool for ASD, and the scores go from neurotypical to severe ASD. I know how to define severe or mild ASD is quite controversial, so we're not going to discuss that today. It's just how the scale works. And it assesses different areas of functioning, similar to ATEC, but it can be used for diagnosis as well. So anyway, so what we were talking about is ketogenic diet versus a gluten-free, casein-free diet in autism. 45 children aged between 3 and 8 years old with ASD. They were divided in 3 groups. The first one received the ketogenic diet, the second, the gluten-free casein diet, and the third group, just a balanced nutrition to be a control group to compare. So they found that both diet groups, so that's ketogenic and gluten-free, casein-free diet, have a significant improvement in ATEC and CARS scores compared to the control group. In the ketogenic diet, they score better results in cognition and sociability compared to gluten-free, casein-free diet. So in a way, you can infer that the ketogenic diet works best. Moving on, again, ketogenic diet is investigated here. So it's been proven beneficial for epilepsy, some types of epilepsy that don't respond well to pharmacological treatment, and other brain diseases that could be related to the high fat. When we say high fat in ketogenic diet, we're talking about healthy high fat. We'll talk about fatty fish, we'll talk about vegetables or fruits that are high in fat, such as avocado, olive oil, healthy fats. We're not talking about McDonald's nuggets and stuff like that. And they concluded that the ketogenic diet is likely safe and effective treatment for ASD. This is, I believe, is a meta-analysis or a review, just because I can see a table with different studies. So here you can pause the video and have a look at these different studies that they included in the research. Okay, and the outcomes. So just feel free to pause it. I can't go through them because it is long enough as it is. So I wanted to talk about number 23, this one. So let's have a look at this one because I found it quite interesting. So I searched that one separately so I could comment it. They selected 16 patients initially. 6 of them managed to stick to their diet. So I think that's quite interesting that they mentioned that, because it seems like it's all easy peasy. You just select the children and they're going to stick to that diet. Some children are not suitable to use these diets just because their diet is already so restricted that excluding further foods, gluten-free, dairy-free, ketogenic diet is also excluding some foods, can put them at risk of malnutrition. And some of them, they just won't accept it. We need to bear that in mind. And it's interesting that they do mention that. So in most of the patients that they selected, they could not go ahead with this diet. They all had autism. Again, one of the 6 patients they highlight showed a remarkable improvement in CARS scale. We've seen that in another study. And the medications he was on, risperidone and hydroxyzine. These are medications that are used to treat irritability, aggression, and anxiety, were stopped altogether. So that's a very, very remarkable improvement, definitely. And it's great that they managed to stop these medications, because in the long term, you never know what's going to happen. I don't mean to scare anyone. If you can't stop these medications, that's fine, as long as you get follow-ups with your doctor and blood tests and everything is under control, of course. But the less you need, the better. The clinical improvements in the remaining 6 out of 6 patients were more subtle, but there were improvements in all of the individuals that were able to follow these diets. So that's pretty good. Here we're back to the systematic review. We're back to this one. So let's scroll down. So it says a ketogenic diet improved the social communication of 1 of 6 ASD patients, but it reduced the comorbidities of all 6 ASD patients. I think it's still commenting on this one, actually, number 23. Yeah, you can see the reference here. Then it moves on to talk about different studies, I believe. Here it says, although a ketogenic diet induced decrease in seizures, so it can help with seizures, will lead to a better quality of life. Obviously, if you have less seizures, your life is going to be better. It won't necessarily improve behavior in ASD patients. We need to keep in mind that anti-epileptic drugs do not have a large effect on behavioral symptoms in most people. Here we have nutritional interventions for autism spectrum disorder. This is tiny. Let me enlarge it for you, then you can pause and hopefully be able to read that. It's really tiny writing here. Okay, hopefully you can read this. So I'm going to leave it there for a moment in case you want to pause it. And over to this side for you. There's some more right here. And over this side. So these are different, what I see, different dietary interventions, supplements, species, different supplements. Specific carbohydrate diet is a diet that excludes refined carbohydrates. That's my understanding. I think it also excludes things like potatoes, very starchy carbohydrates, but you feel free to research those. Probiotics, gluten-free, yeah, just worth checking this out. Modified ketogenic gluten-free diet with MCT improved behavior in children with autism spectrum disorder. What is MCT? So it comes in a type of oil, actually. I did put it here, and anything that is italics, that is things that I have written. So it's not from the study, it's just explanations that I'm adding. So it is basically a type of oil that you can get on the internet. You can get in health shops as well, usually cheaper on the internet. So that's my recommendation. And is usually extracted from coconut oil, but it's not coconut oil. Coconut oil has, I'm not sure, about 10%, maybe a bit less of MCT percentage. So if you really want to use MCT oil, you need to buy it. Otherwise, you need to take a lot of coconut oil to get a significant amount. Anyway, so yeah, we have this diet for 15 children between the ages of 2 and 17 years old. It was trialed for 3 months. So they follow this diet with the MCT oil. The MCT oil can be taken by spoon. You can mix it with food or drink. I probably recommend mixing it with food, maybe using it instead of oil as well. Like when you're cooking something oily, you can use MCT instead, just to help them not finding a massive difference in the consistency of their food. So they say they didn't find a significant difference in restricted and repetitive behavior, but they did find a substantial improvement. So that is larger than 30% decrease in ADOS2. ADOS2 is an assessment of communication, social skills, play, and restricted and repetitive behaviors. Total score, so that was like an average. It doesn't mean that it was 30% in each of these subscales. As they say, they didn't find an improvement in restricted and repetitive behaviors, so that was probably 0 or around 0. So that was observed in 6 participants. We need to remember that that was how many? 15 participants. So about half, or just under half. Moderate improvement in 2 participants, a minor to no improvement in 7 participants. So we can say that about half of them had a moderate to very significant improvement in their symptoms or difficulties, whatever way you want to call them. Influence of a combined gluten-free and casein-free diet on behavior disorders. Again, that's ASD, and a 12-month follow-up. So that's 37 patients. Each patient had consumed a normal diet up until then, for 6 months as well, just to get a baseline. And then a gluten-free, casein-free diet for another 6 months. The 6 months diet did not induce significant changes in behavioral symptoms. Okay, so this one didn't find any effect. So we need to share all the research, the ones that support that these diets are effective and the ones that do not. We need to be honest. And we move on to gluten-free and casein-free diet and autism spectrum disorders in children. A systematic review, that means that they're reviewing different studies in one. So it includes 214 participants. That's the total in all these studies that they were including. There were no statistical significant differences in autism spectrum disorder core symptoms between the groups. One trial found that compared with the control group in the gluten-free, casein-free diet, there were significant improvement in these scores for communications. That's one of the studies. Social interaction, another trial found significant differences between groups in the post-intervention, that's after receiving the diet, for the autistic traits, communication, and social context of an assessment tool, Danish scheme. And the remaining differences, if present, refer to parent-based assessment tools. So they were not standardized assessment tools, I understand, or they could be, but the parents had to fill in the form. There were no adverse events, so that's very important. That's consistent with all of the studies, and it is very important to know that these diets are safe, or mostly safe for most individuals. And they conclude that there is little evidence that a gluten-free, dairy-free, or a casein-free, in this case, is beneficial for the symptoms of ASD. So another one that doesn't find much of an effect of this diet. We're gonna move on to gut microbiome. That's a very interesting one. We talked about this earlier a little bit, didn't we? So it says the composition of the intestinal microbiome, that's the good bacteria that we have in our gut. I mean, we have good and bad. It depends on the proportion and all that they are in balance, basically. They found that after balancing the composition of the microbiome through the use of antibiotics, prebiotics, or probiotics, or microbiota transfer therapy, there were changes in the neurological function after these changes. So it definitely affects, they're talking about this gut is our second brain, and the relationship between the gut and the brain. Hopefully you heard about that. So there is definitely science supporting that. The results show that Lactobacillus plantarum, that's a strain of probiotic, might be an effective strain for the probiotic treatment of ASD. It might be more important to pay attention to the overall balance of the patient's gut microbiome. So that's when I say it's not about having a lot of that so-called good bacteria. It's more about balance. And that is mostly achieved through a balanced diet. There's no secret, there's no magic wand. But you can supplement with probiotics and prebiotics, which is basically non-soluble fiber. After probiotic intervention, the scores of destructive behavior, anxiety, self-focused behavior, and communication disorder in the developmental behavior checklist scale of ASD children were lower than the baseline. So rebalancing their microbiome did result in behavior and mental health changes. Here it mentions about giving 75 newborn infants this strain of probiotic that you can see, or a placebo for 6 months. They found that after 13 years, ADHD and Asperger's syndrome is not diagnosed these days, is diagnosed as ASD, was diagnosed in 6 out of 35 children in the placebo group, and none in the probiotic group. Is a pretty small sample, but it's interesting. So if you have young children, I think it's worth giving them some probiotics. And probiotics can be found through just normal diets. You don't need to buy a supplement. We'll talk about this in a bit. And here we have the Mediterranean diet, dyslexia and ADHD in Greece. So here they found that they have a sample of 210 students in Greek universities, aged between 18 and 30 years old. Some had ADHD, some had dyslexia, and some had no learning difficulties. Most of them, they did not. So they found that the students in the lower tertile of the Mediterranean diet, that means that the ones that had a diet that was farther away from a Mediterranean diet, that can probably be something like processed food, because Mediterranean diet, it does not contain any processed food. It could be a high meat diet as well, because the Mediterranean diet is quite low in meat. So we don't know exactly what sort of diet they were following. We just know that these students that were further away from the Mediterranean diet, they were more likely to have learning disabilities than the ones that were closer to following the Mediterranean diet. Although we never know whether it's the egg or the chicken. We don't know whether people that have learning difficulties tend to have a less healthy diet. That could be why, or it could be the other way around. Having a not very healthy diet will affect your brain development and will make you more likely to have learning difficulties. So again, if you have young children, try to give them a whole food diet, healthy diet, balance. lots of fruit, lots of vegetables, if you can. Here we have the influence of gluten-free diet on mood disorders and symptoms of depression. So here we're moving on to mental health. We're not talking about developmental disabilities or disorders, but I found this study quite interesting, so I really wanted to share it with you. So the objective is to assess the influence of the gluten-free diet on mood disorders and symptoms of depression. So they analyze 13 studies about that, but the majority of the studies found a significant influence of the gluten-free diet on mood disorders and symptoms of depression in patients suffering from conditions like celiac disease or non-celiac gluten sensitivity. Let's stop here for a minute. So there is a physical problem, and the fact that they can't tolerate gluten very well is actually affecting their brain. Then it continues that in many cases, it was noticed that symptoms of depression in children affected by celiac disease were reduced when a gluten-free diet was applied. So celiac disease not only affects your gut, it can affect your emotional well-being as well, and energy levels. Then it says, however, some trials show that after converting to gluten-free diet, the symptoms of depression increased, or it showed no influence of gluten on them. Okay, we don't know whether these patients had celiac disease or gluten sensitivity, does not specify. So the authors of this article came to the conclusion that it is worth considering a gluten-free diet as a complementary therapy to patients presenting with depression. So in other words, it's worth a go. You can stop anytime. I think that's all of them. So I think that was a pretty long video already. So just to conclude, the gluten-free and casein-free diet is safe, and it is worth a try unless it's putting the individual at risk of malnutrition in cases where they have a highly restricted diet, and not having any dairy means that they're not going to have any calcium in their diet because they're not accepting soya or whatever alternatives for that, for example. So bear that in mind. The microbiome most likely has an effect in our psychological health. So it's important to make sure our diet has probiotics, which can be found in yogurt, kefir, and non-pasteurized fermented foods. So your best bet in this last case I mentioned is to ferment foods yourself, because what you get from the shop is most likely being pasteurized, just because, you know, when they mass produce these things, there is a risk of infection. Whether if you do it at home and you take the precautions, you're most likely going to be fine. And if it goes bad, you will be able to smell it anyway. And prebiotics. What are prebiotics? Prebiotics are non-soluble fibers. So they are found in vegetables, in whole grains, and fruit, especially if you don't peel the fruit. So things like apples, pears. I'm not suggesting you to eat a banana and orange peel, but apple, pear skin has a lot of fiber. So it's worth keeping it if you can. And just to finish, these food interventions, these diet interventions and supplements are complementary. They're not meant to replace any behavioral interventions. They're not meant to replace any therapies. So please keep going with these therapies or start them if you want to start them. So this needs to be alongside any other interventions. Dietary interventions are not meant to be standalone interventions. So I hope you found this interesting and useful and helpful, hopefully helpful in your life, and you can put some of these in practice and give it a go. So thank you very much for listening and for watching, and I hope to see you in my next video. Bye for now. If you like this video and think that others can benefit from this content, please like, share or subscribe. It all helps me reach more people, and I'm sure it can make a big difference to many families. Thank you.